Hey, I'm Dr. Joffrey. We're going to jump right into this. So you or your loved one have found out that their PSA level is elevated. Is it elevated due to cancerous reasons or non-cancerous reasons? Please check out a previous video where I discussed the 6 main non-cancerous reasons. But let's just right set the room. Your prostate, only men who were born men have a prostate. And the prostate, it is found just under the bladder and anterior to the rectum. The main purpose of the prostate is to produce PSA, and that PSA, it helps the semen to be more mobile. It helps liquefy. That's the main purpose. Can you live without a prostate? Absolutely. But let's just jump right into this. So your PSA is elevated. Relax. Relax. It very well may not be cancer. What are the next steps with you and your doctor? Your PSA is elevated. There's some different steps. There are steps that your doctor is going to take. And not every doctor takes it in the same order. First, critical one is your primary care doctor should be referring you to a urologist. A urologist. That's a doctor who specializes in prostate problems in men. Your primary care doctor may also choose to start you on some antibiotics. Why may they start you on some antibiotics while they're waiting for you to see your urologist? Because in the previous video, we talked about an inflamed or an infected prostate can cause a rise in your PSA, or urinary tract infection can cause a rise in your PSA. So it's fine. Let your primary care doctor start you on antibiotics. But a few different steps are going to happen. A, they're going to refer you to a urologist. 2, they will also repeat that PSA. Here's the truth. Sometimes labs get it wrong or there's a lab error. So they will repeat that. But at some point, you will be asked to repeat the PSA, have an ultrasound done, and or have an MRI of your prostate done. And in the final analysis, the only way to determine if you have prostate cancer, even though they do all those tests, is a biopsy. Yes, for most cancers, the final diagnosis lies in a biopsy, which means you've got to get tissue. There's a few different ways that they can biopsy it. They can go through your rectum and do a rectal biopsy, or they can go through your penis with a camera and biopsy it that way. Talk to your urologist about what's in your best interest and see which one they choose. But the whole goal of this talk is to make it simple. And that is, at the end of the day, the only way to diagnose you with prostate cancer, it's not just an elevated PSA level, it's a tissue biopsy. And even once they get that tissue biopsy, if that biopsy shows cancer, there's a thing called slow growing cancer. Let's just use that term, slow growing cancer. In other words, slow growing prostate cancer means that based upon a lot of evidence from academic articles, many slow growing cancers show that you will likely outlive that cancer. In other words, when you pass, it won't be due to that cancer. Let's go back to this biopsy. So when they do a biopsy, then they're going to give you a Gleason score. A Gleason score just looks at the cellular structure of each biopsy. And in general, they do about 12 biopsies in different areas of your prostate. Pause real quick. By having an MRI prior to the biopsy, it gives them a more focused area. It helps them focus on where they want to biopsy in case if that MRI showed some areas of concern. Back to biopsy. So once they biopsy you, and they'll do 12 different points. Based upon this cellular structure, and based upon your PSA, they will assign you a Gleason score. they will assign you a Gleason score. And based on that Gleason score, it will help determine A, if treatment's needed, B, the type of treatment. Let me land my plane here. It's not that linear in terms of if you get into the treatment phase, because everybody's body's different. Everybody's biopsy is different. Everybody's PSA is different. Everyone's comorbidities are different. And even the skill set of the urologist, and not just the skill set, how the urologist chooses to move forward matters. But in other words, if your PSA level is elevated, it does not necessarily mean cancer. And if you find that that elevation is true, it's so important for you to follow up with a urologist. If you found this video helpful, be sure to hit the subscribe button. Be sure to like. Be sure to share. Talk to you soon.